Today we're going to talk about when shortness of breath isn't just a harmless little bit of I can't catch my breath and when it's a red flag. But I also wanted to point this out. This is what it looks like in the afternoon like this in my house because I have a beautiful, fairly small sticker that is on my window, and this is what comes through. I'll link it below if you're interested. It's from a lady off Etsy, and all the stickers are pretty, and all of the designs that come through your window are gorgeous as well. So let's get talking about this. I'm Nurse Lisa, and today I'll share what science says about when shortness of breath is harmless and when it's a red flag. According to the American Lung Association and the Mayo Clinic, it's actually normal to feel winded after climbing stairs, exercising, or even if you're in hot, humid climates. If you recover within a minute or two, that's usually just your body working as it should. However, it can also be normal if you are deconditioned. I know for me, I'm always thinking, why am I out of shape? How come I can't climb those 4 flights of stairs when I've been doing it for the last 5 years of working here and it still feels the same? Well, part of it I know in my situation is I have asthma, and you don't have asthma just when you have a flare-up. You have asthma all the time, and you're going to feel it in situations like that. It's not necessarily a red flag though. If you're deconditioned, you might just not be used to that activity yet. And yes, even mild anxiety can cause temporary shortness of breath. Panic can cause a feeling of shortness of breath. Lots of people go to the ER thinking they're having a heart attack when really it is anxiety and panic. But here's when it's concerning. Both the National Heart and Lung Institute and the American Heart Association warn that shortness of breath at rest and with very little activity is a red flag. If it's getting worse over time or it's paired with chest pain, coughing, wheezing, blue lips or fingers, swelling in your legs, fever, you should seek medical attention right away. If your shortness of breath is sudden, it's an instantaneous onset, and again, might be accompanied with some of those things that I mentioned, you need to seek medical attention immediately. What does emergent, instantaneous onset of shortness of breath indicate? Sometimes it can mean a blood clot. Sometimes it can mean a heart issue. Sometimes it can mean a lung issue or a severe allergic reaction. All of those things require medical attention. So a good rule of thumb, if you cannot speak in complete sentences without gasping for air or breathing doesn't improve with rest, don't ignore it. Get it checked out by your provider or go to urgent care or the emergency department if in doubt. I'll link the science-backed resources from the American Lung Association, Mayo Clinic, American Heart Association, and National Heart, Lung, and Blood Institute in the description below. As always, I link my resources. Have a wonderful evening. Please come back for some more health tips and consider subscribing and sharing this information.